raise their hands, we will bring the microphone to you to ask questions. We have about 15 minutes for questions.
Okay, we got our first one.
You said that there were 260, I think you said, 1,000 comments. And from what I recall, that only happened earlier this year. So, does your organization believe that this administration took the time to read those comments? And if not, how do we fix that?
So, actually by law, the administration is required to consider every unique comment that's submitted. And that was actually our strategy. That is the reason why we engaged so many sectors as we did. That is the reason why we asked them to submit unique comments, because it was all towards the strategy of delaying the implementation of the rule. That being said, and this is me putting my negative Nelly hat on, I don't think they did. And we are preparing for potential litigation to challenge based on that. So those are some of the next steps that we're thinking of. Had a perfect presentation.
Thank you so much for your presentation. As we all are aware, census is happening next year. And my question to you is, how do we get, what are the strategies that you at the national level are thinking of if the immigration question is on the census? In fact, as you know, the island is very diverse, and we are working the strategy in-house, but we'd love to hear your recommendations. Thank you.
Yeah, I mean, my colleagues at the National Immigration Office are much more well-versed in this, but I believe we have three primary levers that we try to use: litigation, advocacy, and oh my gosh, what am I forgetting the third? Litigation, advocacy, and yeah, I need to mobilization efforts. So we're basically coming together with our partners, like nationally, including NALEO and other partners, to do, I think, a strong communications push and to make sure that despite, whatever the outcome is, I think our community just needs to know what's going on. And once again, can make those informed decisions for themselves as to whether to participate in the census versus not.
Thank you very much for presenting today. I would like to tell you that we widely shared your campaign amongst the Health and Human Service teams that I work with, and I know that they submitted comments, so I feel like some of that 266,000 actually came from Rhode Island, so yay, Rhode Island. Yay! So I wanted to ask you, because you have a national lens on this, is how many states are taking active steps to make sure that their agencies that deal with public benefits are actually having agreements or policies around information sharing with law enforcement or immigration officers? Because I think that's a big concern. And I'd love to know how many states. I know Massachusetts has some policy, but I'm wondering if they're alone in that.
Yeah, I don't have a specific number, but Massachusetts, you're right. The Attorney General is actually putting together some model policies that really promote having safe spaces and talk about an immigrant's right to privacy in terms of having confidential information provided to their health care center, et cetera. California also passed something called the California Values Act, and I think Washington just signed something into law as well that's very similar in terms of instructing the Attorney General to create policies that are not just covered, I think, within the sensitive locations memo, and I know that there's going to be another panel that talks about specifically safe spaces work that's happening across the country, but it's expansive. So for example, they include public libraries, right? Because it's also a public space in which immigrants go, and we want to ensure that they feel safe and protected in. And it's all about limiting ICE enforcement in these very sensitive locations. Colorado, I think, tried to institute a bill, and their state legislator, I think it did not make it to the final round this time. But yeah, there's a number of efforts across the country because I think tied with public charge, these concerns is a concern about how confidential and private one's information is when they do seek out these basic needs programs and these services that they need, right? Whether at a food bank, at a healthcare center, or whatnot. So I don't know if that's helpful, but.
As someone who works, as someone who works with school districts and state departments of education, can you talk a little bit about the ways in which we might be able to support pushing in the direction of making sure the public charge things don't come down on immigrant communities based on the kinds of services like you mentioned, like school lunch programs and things like that? Are there certain states that are doing that really well? Is there any guidance that you can provide for us to kind of think through?
Yeah. So some of the safe spaces. So I'll point to LAUSD, for example, as I'm from LA. They've actually been training their staff and specifically engaging their parent centers to talk about public charge. I just want to note that within the campaign, we're creating quite a number of community-facing tools, like a risk assessment tool, just various analyses that hopefully advocates and service providers can take on in terms of kind of educating parents and children about this. There's a Safe Spaces project that's within NILC where we help schools as well as healthcare centers, and then actually our partners at CLASP have just come out with a wonderful early education center guide. So if you are a childcare center or an early ed center, they just came out with this great guidance that I would hope that you'll take a look at on their website. So a number of different ways. As I mentioned during my remarks, this issue is really wonky and complicated. And so what we found is that it takes quite a number of trainings beforehand to even understand what's going on. And so what we've been doing is encouraging our partners to start training their partners now, knowing that we're going to have a very rapid response once this rule gets finalized, and that there's going to be a huge outcry arising from the community.
Thank you so much for being here. You mentioned next steps and advocacy, and I work for a community action program. And I'm wondering, you mentioned tracking the impact and documenting the harm. Can you speak a little bit more on what that would look like?
Yeah, so this actually goes towards a number of our different strategies, our advocacy strategies, our litigation strategies, and communication strategies, but we really want to be able to show hard numbers as well as highlight the stories of what we're seeing on the ground within our various communities. And so I do want to note we are likely going to have a webinar later on this month that talks all about documenting the harm and provide some really concrete steps on how to do that. But in light of the privacy protections, I think what we've been trying to do is encourage agencies, number one, to track the impact, right, writ large, but also be careful about the type of information that they're collecting as well. So there's kind of this fine line that we're trying to walk, essentially. But yeah, I would highly encourage you to register for the webinar once it becomes public, and we'll talk about that more.
Oh, hello, thank you again. I joined with everyone here, very inspired by your words. One of the things I think of is we're a small state, and it seems like state by state we're going to have to deal with this. And I'm noticing just a lot of grassroots things going on. And I've heard about the Florida Compact. Are you familiar with that?
I believe so, but please.
All right, so as I understand, and this was a few weeks ago, I heard about it, and I didn't get a chance to get into it more, but it's a gathering of states to create a buffer space and to move ahead with safety in the community, both in schools, community centers, service centers, human service centers, and so forth, so that there is a way to address policy at the state level, but not state by state because you get lost. But if you have, like, in my mind, I see like a New England compact. You know, if all of the states in New England get together and push back, you know, really create alternative policies, I think it is possible. But it's leadership and, you know, where do you go to really spin that kind of energy and pull it together? Where do you?
Yeah, I love the idea of the New England Compact. What the Florida Compact sounds like is something very similar to the California Values Act and kind of some of the, what I discussed in my previous remarks. Definitely, yes. I think there's also at the federal level, there's something called the Sensitive Locations Act, which is all about passing legislation that would combat the memo, right? That talks about, ICE not being near schools, courthouses, whatnot. But what we've been encouraging at the state level with regards to our partners is to be even more expansive than that, right? So for example, public libraries are not included in the Sensitive Locations Act, but it's included in the California Values Act, right? I think people are being really creative at the state level in terms of trying to think expansively about where immigrants go to get the basic services